as Phyllis just mentioned, the other real challenge that we have is that some of the well-researched, well-known science is being rolled back in the moment, right? So this idea that you're using a medicine for recovery, it being a negative thing, is only attached really to drug use problems. Right? When we use a medicine for recovery or stability, when you're living with diabetes, for example, or living with COPD, that is not judged as somehow not being a good way to take care of yourself or not being the gold standard of care. In fact, it's judged in the opposite way. If you were a provider not providing your patient who's living with diabetes with the appropriate medication interventions, you would be liable for that. And what we're seeing is this sort of turnaround in the field of addiction, where there is the medicines themselves, which actually save lives and work very, very well. They work better than almost any medicine for any other chronic illness. As a matter of fact, these medicines are being stigmatized even more strongly than they have been in the past. And healthcare providers are being encouraged at some level, or certainly not discouraged from saying, I don't take care of this kind of person. And that's really not okay from a medical perspective, a clinical perspective, a cultural perspective. And I would suggest, as this conversation has been sort of thematically organized around, that kind of decision-making is more strongly endorsed among women and among parenting women.